Dr. Mikel Maria Delgado, you have the back of all cats and of me. I recently did an episode about cats vertical peeing out behind them. And you wrote to me and said, that's not really marking. That's a different way of peeing. So maybe I framed this story differently or asked the question not correctly. You have a great video of one of your kitties who pees backwards. So talk a little about vertical peeing and what, where, and how that happens.
Sure. Yeah. What I have typically heard this behavior described as is elevator butt, right? The cat starts on the ground floor, and then as they're peeing, the butt starts going up. And we really don't know how common this behavior is because it usually doesn't present as a problem for the caregiver peeing outside the litter box, as in house soiling, right? Peeing on your bed,
Right,
peeing on the
right,
carpet, peeing on the
right.
counters, right? So, because this behavior tends to occur in the litter box, there's really no research on why some cats do this, right? We know not all cats do. So typical posture for elimination for cats is to squat. First, they'll do a little digging, create a
Yeah.
nice little spot for themselves, and they'll squat and urinate. And then do a little covering and go on their way. You know that when cats defecate, they have a slightly different posture. So if you spend a lot of time observing your cats in the litter box, like I do, you know that when they're pooping, they're in a slightly different posture, maybe
Right.
not as deep a squat. But then there's this group of cats who pee vertically, or they, again, don't fully squat while they're urinating in the litter box, but they're still voiding a large amount of urine, right? So we know that when a cat is urine marking, it tends to be a small amount of
Right.
urine. And then that's actually been
Yes.
quantified. There was a study that came out a while ago that suggested that when cats are urine marking, it's 5 to 20 milliliters of urine, as opposed to when they're voiding their bladder, they're peeing, they're emptying their bladder, like
Right.
when we have to go to the bathroom, and it's more
Yeah.
like 60 to 120 milliliters.
Wow.
So a lot more.
Yeah.
So we have this decision tree, right? Is the cat eliminating or are they marking?
Yeah.
And so if it's a larger amount of urine, we tend to go down the elimination route instead of the marking route. So the question is, why do some cats do this? And the answer is we don't really know. So we always want to rule out a medical issue. Certainly, if
Right.
you have arthritis or you're overweight,
Yes.
you might not fully squat. And so you always want to make sure no urinary signs, no arthritis signs, no discomfort in the litter box. Is there something about the litter they don't like? They don't want to fully squat in it. But aside from that, we really don't know. But I do see it, like you mentioned, one of my own cats does this. And I have had clients, for example, reach out to me, oh, my cat's urinating outside the litter box. And when we dive in a little deeper, the cat's 4 feet are all planted in the litter box, but the butt is hanging out over the edge. So that could be a too small litter box, right? So if there's
Yes.
not enough room for the cat, that could be an issue. But then some cats just do the elevator butt, they're raising their butt, and the pee is going over
Yes.
the edge of
Exiting.
the box, right? And so that creates a mess to clean up because the urinal pool,
Oh, yeah.
on the wall or the floor under the litter box. So there's a whole suite of tools for people to manage this
Really?
problem because when someone presents this to me, it's like, okay, your cat actually knows where to go to the bathroom, right? They are in the
Right.
litter box, all
Right.
four paws are in there. They just aren't positioning in a way that works for you and works for them. So we typically respond by providing them with, so a high-sided litter box is one way to contain the behavior. We always want to
Right.
make sure there's a nice little entryway for the cat to walk in easily.
Right.
But if the walls are bigger, then that splash will hit the walls of the litter box and just drip down rather than going all over the wall and under the litter box on the floor. There's also a really cool product called the Pee Shield.
I
I use
love
these,
it.
right?
You
And these
do?
just, oh
A pea
yeah.
shield. I
Yeah, so
love
these
that.
just Velcro to the sides of your litter box and extend
Wow.
the height of your litter box because a lot of litter boxes just aren't tall enough to contain my cat. She can raise her butt pretty high. So we need lots of height to contain her pee. And so these are great. They come in packs of 3, I believe. And yeah, it's the Bee Shield.
That's so
Nice company,
great.
really sweet
I
people. So
like that.
yeah, so that's a nice, affordable way to transform your litter box into something that helps you manage this behavior, which again isn't really a problem, except that if you don't properly manage it, it will get pee on your floor. I do want to mention though that I think the other thing is we've always thought of there's elimination or urinating, and then there's urine marking. And we actually don't know how clear that path is between the two behaviors. So there is a possibility that the cats who are standing up and peeing in the litter box are also marking, right? We know that
Interesting. Yeah.
urine has a lot of meaning to cats that we don't really
Yes.
understand. It doesn't have negative associations for them necessarily, right? When people,
That's right.
if a cat pees outside the litter box, people get very offended, but the cat is not offended. The cat is not offending you in their mind, right? This is a
Right.
very normal thing for them. They like to investigate urine. They get a lot of information about other cats from urine. So I think it is possible that there is an emotional component to cats urinate standing up. And I bring this up because I observe when my cat does this, she's often pretty excited. So I'm like,
Oh,
was this a coincidence? But the other thing I will mention is that we recently put her on behavior medication and she no longer urinates standing up.
wow.
Yeah, so
That's
that's just
huge.
an N of one. So
It's
I
an
don't
N of one, and you're a scientist, but you are a
so it
feline behaviorist. That's
yes. So
fascinating.
it does make the gears in my brain start spinning a little bit. We
Wow.
really don't understand if there is a psychological component to the urination standing up. But I will tell you that a recent study also found that urine deposited on a vertical surface smells more potent
No
than urine
kidding.
deposited on a horizontal surface. So something about, and this is way beyond my
Right.
scientific knowledge, it
Right.
has to do with viscosity and the chemical properties
Wow.
of urine and everything, but the way it adheres to a vertical surface seems to make it ideal for transmitting information to other cats. So
Wow.
again, more questions and answers.
Fascinating.
Yeah,
But so cool. First, when you were saying you had the vertical pier, the elevator butt lady, I thought she picked the perfect person to be her mom because you can handle any situation with grace. But
sure.
how fascinating that by putting her on behavior med, that behavior just now when you that behavior stopped. When you say she was excited, do you mean she was quivering? Her tail was quivering? What do you mean as a scientist by excited?
Yeah, great question. She would just be when your cat has the zoomies type running around. So there would be even just the expression on her face look a little. She's on behavior meds because she's a little overexcitable, and that translates into chasing my other cats. And so
Oh,
so that behavior is much better as well. It's just interesting to see now she's calmer in general, and she's also squatting fully when she urinates. So it's just, like I said, a very interesting observation. I do think, and the other thing too, when we talk about urination outside the litter box, then we go down the whole is it peeing or is it marking, is just that those are identified as problems. And so again, this behavior may fly under the radar for a lot of people because it's contained, they have a covered litter box, they don't even know if the cat's
right.
spraying vertically or urinating vertically in the litter box. So again, more questions and answers. So it's never that simple, but I think in this case it was pretty simple. The question was really just how do I manage when my cat is
That's
peeing over
right.
the edge of the box?
Right.
And is that truly urine marking? We don't know.
But in all likelihood, no. But what's
In all
really
likelihood, the cat is voiding their
right,
bladder and it just is, again, escaping the confines of the litter box.
and or as a friend of mine used to say about one of her cats, it was an honest mistake. You know,
Exactly. Yes.
I think that's a really great way to describe out of
I love
it's
that.
in letterbox, out of litterbox issues. An
Yes.
honest mistake.
Yes.
And the I guess the only other question is, are you allowed to say what the med is that she's on? Not that we're sitting here telling people to ask their vet to put them a cat on a med, but I'd be curious to know because you only base your everything you do on science.
Yeah, so this is actually the second behavior med we've put her on. So we
Oh,
we started her on fluoxetine, which is the generic form of Prozac, but she actually experienced urinary retention on that medication. So she was only
wow.
peeing once every 24, 26 hours. And so
Ooh,
our veterinarian was not comfortable with that. I wasn't comfortable with it. And she was also a little more lethargic than I wanted. So we weaned her off that medication and then we put her on a medication called Effexor or venlafaxine, which is an SNRI instead of an SSRI. And she's doing great
wow.
on it. So it's actually a really cool medication. We can talk about it sometime, but it
Yeah, we
comes in
should do a
these little
segment on it.
tiny it's little tiny granules that you can put in their food very easily, as opposed to Prozac tastes very
Right.
bad, so it's much harder to administer. So the venlafaxine comes in a capsule with little granules, and you have to count out a
Oh
small amount of
my
granules. But
goodness.
you can just put it in food. It doesn't seem to have any flavor. I put it in a gel cap, and my cat's trained to eat gel caps. But anyway, many fewer side effects, but still getting the benefits of the medication.
Nice.
We've had, I think, a month of no hissing, and
No
like I said,
chasing and
and
no
she's
no elevator butt.
exactly no elevator butt. So it's very fascinating.
It is fascinating. We'll have to do a segment on medications and medicating because
Sure.
obviously that's a great topic. Dr. Mikel Maria Delgado, Feline Minds. You are such a feline minder. Thank you so much.
Thank you, Tracy.